Perhaps some of the topics I'm hearing a little bit more as families and kids are getting ready to go back to school is getting back on a good sleep routine. A lot of times when we're on summer vacation, we don't have a lot to wake up for. We can sleep in a little bit, stay up a little bit later. So a couple of weeks before you get into going back to school, you do want to try and get back on a good sleep routine and habit. The second, probably biggest thing I hear about is screen time, because again, summertime's a big time to be playing on iPads and video games and watching a little bit more TV than usual. You do want to try and scale back on some of that and start talking about guidelines as the school year comes around. Anytime your child is having any symptoms that makes us worried about their vision or hearing is always a good time to think about testing, even if it's been done recently. My personal rule of thumb is trying to get your eyes checked at least once a year, because some visual changes can happen before they have obvious symptoms. We want to make sure we address those before they get back into school and have to study and do well in their classes. It's definitely tough sometimes to tell what's truly related to anxiety with school and testing versus a separate etiology such as a stomach bug or a viral illness. Those are times when you can definitely reach out to your physician or your provider to talk about your child's symptoms and make sure they're not a clue to something else that needs to be addressed.